We found Bridget. Bridget, you were lost for a little bit, and you're back.
Cyberspace.
I was just going to say what I was talking about is how amazing you were, and you were such a great mentor and always someone who I could go to ask questions.
Oh.
Because there's this thing like nurses eat their young,
Mm-hmm.
but you like it wasn't like that. Like you were totally supportive, and I love that about you.
Thank you.
So let's talk about, we were talking last about you were in the neuro ICU
Mm-hmm.
and then you wanted to learn more. What was that? What was your next step from there?
I realized that because of all the experience that I had in ICU, that I knew nothing about a laceration, a rash, a
Okay.
headache. Like
Huh?
neighbors would go, I've got, they'd come in with their kid and they're like, what do I do? And I'm like, they're not dying. I don't know. And so I was like,
Right.
all right, I need to actually learn more about the general population. And so
Okay.
I decided to shift my focus and put it on ER. And it was a
Okay.
huge step for me because I was, I'd been ICU for so long. And I was like, okay, I'm going to do this and I'm not going to be afraid and I'm just going to go for it. And I got a job, not where I'm at right now, not level one. I wanted to start off small and then kind of work my way into it. And I got a job at a level 3 trauma center. And
Okay.
it allowed me to learn about the coughs, the colds, the rashes, the chest pain, all the basic stuff that everybody will come up to you and ask, what do I do about this?
Were you
And
so
so
nervous
I
switching from
was,
ICU to ER?
yeah. I mean, I knew how to take care of a very critical patient, but I
Right.
didn't know how to take care of the general population
Okay. Yeah.
and, just their signs and symptoms. I knew how to save someone, but I didn't know how to not diagnose, but I didn't know how to treat somebody that was just coming in with basic stuff. And so it caused me to shift my focus and go, I want to learn about this. And so that's what I did. I went into the ER and I learned all about it. And after about 5 years, I was like, I don't know enough about the heart.
Okay. And then what?
And I was like, okay, where's the best place to go to learn about the heart? And I said, okay, Texas Medical Center,
Hmm.
the place where they do a lot of heart transplants, a lot of cabbages, a lot of valve replacements, cutting edge stuff.
Hmm.
And I went and I got a job there. And
I just love it. You're like always eager to learn and always going where you could be taught more.
yes, always, always, always. If I want to learn about something, I go all in.
It's
And
so
that's the
awesome.
beautiful thing about nursing is that
Oh, for sure.
you can do that. Like if you want to learn about any, system of the body and see, specialize in that, you can go that route. 5 years later, you learn all about it. You become very um, experienced. You become an expert. Then you're ready for the next system. And so I just, that's why nursing is so amazing is because you can do all of that. You can go anywhere you want. You can seek out all the information that you want and, learn everything that you want to learn. But it's about you have to want to learn.
Right. Exactly. Yep.
That's the key.
Eager to learn. Eager to learn.
Mm-hmm.
What is the average like nurse to patient ratio in the ER? And right now you're working at a level 1 trauma center.
Mm-hmm.
So what's that look like?
Um, at first, it was 6-1, and we've made some amazing changes, and we're at 4-1, which is the actual national average. And
Okay.
so we're at 4-1. But the thing is that the there's no cap. So patients walk in, and you have to be able to adapt. So even though it's a 4-1, doesn't mean it's going to be a 4-1. You have to be willing to take on
Right.
more, at
Okay.
any given time because it's about the patient. It's all
Yeah.
about like treating the people that are coming in. You can't just go, you know what? I've got my 4 and that's it. You
Right.
know, you
Yeah.
have to be willing to adapt and take on more patients because, um, like when I'm in the trauma rooms, sometimes we can have 5 or 6 patients per nurse.
Hmm.
because there is no cap. People come in, they need to be treated, they need to be seen. And so you can't just say, well, I've got
The
my floor.
ER, like it's
Yeah.
open for anyone to come in. You got to be willing to be able to help anyone who walks in.
Yeah. You have to be adaptable. I think
Yeah.
that's the biggest thing for being a good ER nurse is being able to adapt to the situation and
Okay.
being able to kind of navigate through organized chaos. And I love it. I love organized chaos.
That's so I want to, since you're talking about organized chaos, that's
Mm-hmm.
so like the ER personality is like multitasking, but with your experience in the ICU, the one thing that everyone talks about is how the cords use an example. Like ICU nurses are like, the cords are so pretty and everything is labeled and dated, and like in surgery or in the ER, it's like just stuff's tangled everywhere.
Yeah.
Because you really have different priorities. So can you just explain like maybe the personality differences or
Well,
just the
yes. I mean, there are different personalities that will attract nurses to different types of specialties. So you've got the ER personality where you're all in, it's adrenaline, you're just like getting stuff done and you're running around and it's chaotic. But then in the ICU, there's chaos too, but it's not like the ER. So you can label all your lines and everything can be perfect until your patient goes bad.
Right, exactly.
Right?
Yeah, exactly.
And then all that goes out the window. But
Yeah.
I do struggle a little bit with, because I've got such a strong ICU background, is that I've got a patient and I'm putting them on the stretcher from the CT scan, and their cords are wrapped around their bodies and they're not labeled. And I'm just like, oh my gosh, like it's so hard for me. And sometimes if I have a little time, I will actually label stuff just because that's like my intrinsic way of doing it.
That's so great.
But yeah, I mean, I think at the end of it all is that ICU nurses, ER nurses, there is a little bit of adrenaline to both ICU.
Of those.
Yeah.
Yeah.
Like when you're in the ICU, there's a code, or the patient just comes out of surgery. You're like hands on and things are happening and it's really cool and exciting. And it's in the ER,
the same but different.
Yes, it's the same.
It's like the same but different. You know what I'm saying?
Yeah.
Yeah. I love any advice for a new grad who wants to be an ER nurse? Like, what advice do you have for them? Any interview tips or anything?
I think you have to really like look at yourself and go, am I the type of person that wants to be pushed to the edge? And can I maintain a level of compassion at the same time as being pushed to the edge?
It's a great point.
Yeah. And, being able to like critically think is such a strong part of ER nursing. A patient can arrive in triage and all you have is your assessment skills of, you don't have labs yet, you don't have an EKG yet, you don't have anything. Right. And so you have to look at that patient and go, top to bottom, are they making it up? They do, let's be honest. Right. Are they really sick? Or are they somewhere in between? And so really honing in on those assessment skills and being able to like look at somebody and go, they look sick. And that comes with time, right? And experience. But as long as you're somebody that asks questions, like if you're somebody that like wants to know everything that's going on, you want to know the rationale, and you're willing to come out of your shell and go, why, doctor, blah, 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 why did you do that? Why did you order that? I don't get it. And being able to like listen and kind of process that in your head, it will make you like an amazing nurse, because that's where the critical thinking happens.
Right. And not being afraid to speak up, especially in an environment like the ER. I've been in the trauma base with you. As a nurse, you are a patient advocate, and you can't be afraid to speak up in a fast-paced environment with docs and other nurses, around you.
Right. Exactly. And that's just always wanting to learn, always wanting to learn. I mean, I think a person for ER is somebody that is energetic, right? Because you're running all day. You get like maybe half-hour break, but that's okay if that's what you like to do. Like I love running around. And being willing to not just take care of that patient at a fast pace, but also be somebody that's willing to be compassionate during that fast pace.
Right.
Because I think there's a lot of people that get into ER and they just want the fast pace. But you have to also look at the other side of the art of nursing, right? And that's being able to be compassionate and tell that patient, like the best times in ER that I've ever had is like holding somebody's hand and going, it's going to be okay.
Right.
And to me, that like does something to me that keeps me going for 25 years. Love it.
I can't believe 25 years. That's so awesome.
Yeah.
I love that. So tell everyone what you're in school now.
I'm 1 semester away from graduating as a nurse practitioner.
Yay. Congratulations. I love
you.
that. Is anyone else in school, or maybe you want to go back to school? Let us know down in the comments below. And also, if you have any questions for Bridget about ER, type them in and we will ask you live. Pretty question. So MP school, you graduate in a semester.
1 semester.
That's awesome. Are you so excited?
Still don't know what I want to do when I grow up.
I love you're still learning. Like, so what made you want to go back to school?
I felt like, okay, so there was like a shift that happened maybe 8 years ago. I went through, like I said, did med surg, and then I went to the neuro ICU, and then I went, I've done every single kind of nursing practically that there is. And I felt like I finally, after 20 years of being a nurse, I finally felt really, really competent to be able to make those decisions. Like I'd be at the foot of the bed going, I want to order this, 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 and this. I think that this is happening. The differential diagnosis is, here's the treatment plan. And my mind shifted from being a nurse to being a provider, a diagnostic provider. And that's when I knew I need to do this.
Good for you. I'm so proud of you. I think it's great.
I know. I love it. I'm very scared. I think it's a healthy fear because, you have people's lives in your hands, and I don't want to make a mistake. And
that's normal. That's okay. I know a lot of nurses have recently just graduated. They just passed the NCLEX. They're going into their first job, and they're always like, I'm so anxious. I'm so scared.
Yeah.
That's normal. That's going to prevent you from making a mistake.
That's such a healthy fear to have. Yeah. And so when you get away from that and you're like, I got this after a couple of years,
right,
you have to kind of look back and go, okay, do I really have this? And I think being fearful a little bit is also beneficial because it makes you be a really, really safe nurse.
Yeah. And that's so, so important. It's the nurse you worry about who comes in and thinks they know it all. That's like, okay, I don't know about that.
Yeah, exactly. Exactly.
Yeah. It's like, I don't know. But I want to talk about something real funny. You told me this story a while ago, but I want to bring it up for everyone watching. And this is the ER nurse Bridget's staple remover story. Bridget, can I get a staple remover, please? Pretend I'm a doctor and I'm like, Bridget, give me a staple remover.
Okay.
Tell everyone.
This is so
great.
But it might be useful because there's got to be a lot of little Bridgets running around there just graduating.
Okay, let's do it.
Okay.
I'm so excited about this.
Okay. So I was brand new, not even a year out, and I was just trying to please. I'm trying to get my bearings. I'm a brand new nurse. I'm green. My preceptor had beat me down to nothing, right? finally get out of, like, I'm on my own.
Uh-huh.
And I'm like, I've got my own patients now. I'm on my own. I'm so good. And this orthopedic surgeon walks up and he is like, can I get a staple remover? And I'm like, yeah, I'll be right back.
Right back.
I am trying to please. I am running to the nurse's station, only focused on the secretary, because I know she's got what I've got, what I need.
Mm-hmm.
And I walk up, can I get that staple remover? She's like, here you go. I'm like, thanks.
Oh my God.
And so
cheeks hurt.
I run back into that room. He's got this dressing like laid up wide open, and I'm proud as a peacock. I'm like, here you go. And he's
oh my gosh. I can only imagine you right now.
It was, and here's the thing, like, I didn't even really know for a little bit. His
that
face
you had it wrong.
Drops. And I'm like, what?
That is the best. That is like, so great.
A skin staple remover. I was like, they have those?
What is that? Oh my gosh.
I'll go look.
That. I love that. But as I think, as when you're a new nurse, you're gonna make little mistakes like that. You know, you're gonna learn. And it's just, you're not gonna know everything. And that's okay. Like, it's okay. You're gonna be fine and great. And you're gonna learn from all those little funny stories.
Oh, absolutely. I mean, I can't even count how many times I made a complete idiot out of myself. And it's because I'm willing to go out there and ask questions and feel like I don't know. I'm relying on you to give me the information. And being vulnerable like that, I think, is really, really key to growing. You know, being able to go, even though I maybe should know what you're doing right now, I don't, and I need you to explain that. And so I think that's been such kind of a benefit, that I've been able to be able to, like, be vulnerable and ask questions. And if you're afraid to ask questions, you'll never know the answers and you'll never grow. Right. And so it's so key. So key.
What is your favorite part about working in the ER?
Oh my God. I love nurse. I love being a nurse. And it's not a coincidence that I've been basically at the bedside for 25 years. There's not a lot of people that can say that. And it's because not just the ER, but nursing in general, I love connecting with people. I love making a difference. I love making somebody feel like they're going to be okay, or just providing that little tiny support that they might need. And then also, you know, critically thinking at the same time. And I like ER because they come in and you don't know what's wrong with them. They just show up. They could be a gunshot wound. You don't know how far it went in. They just roll up on your front doorstep, and you don't know. I mean, it could be in the shoulder, but yet you don't know if it, like, ricocheted the bullets and it's going through, you know, a major vessel. You don't know. And so being able to, like, use your assessment skills and critically think and then come up with a plan. ER nurses have a lot of independence. You know, we kind of help the doctor, you know, guide them.
Yeah, for sure.
Yeah, we do. We go, hey, this is what we think it is. And so that's what I think I love about it, because it could be anything. It could be sepsis. I love sepsis. I mean, I don't love sepsis, but I love working up sepsis, and I love working up trauma and orthopedic injuries. There's so much that you can see in the ER. It's like endless. Just when you think you've seen it all,
it comes rolling in. That's okay.
Right in. Yeah. And you're like, wow, I have never seen that.
I
And it's
love
just
it.
fun and just the energy, you
Yeah.
make a lot of friends and it's just fun. And,
Yeah.
but I think the key thing is that you can still make a difference,
Yeah.
you
Oh,
know?
totally. You can make a
Yeah.
difference. You're amazing, Bridget. I love you.
I
I
love
miss
you.
you.
I
Thanks for
miss
all the
you.
work you do. Good luck in nursing school. And to everyone out there, thanks so much for watching. I'm Nurse Blake. This is my friend, Nurse Bridget. You could find me on
Thank you.
Instagram, and you could also check out my videos on YouTube at Nurse Blake. Thank you guys. Have a great evening. Good night, Bridget. Get some
Good
sleep.
night. Thank you.
Bye.
Bye.